If you have swelling in both arms from lymphedema, keep watching this video for a full lymphatic massage routine that's designed to help reduce the swelling, decrease discomfort, and improve the mobility of both arms. I'm Dr. Alex Hill. I'm a board-certified physical therapist, and I specialize in oncology, lymphedema, and pelvic health. Make sure to subscribe for more videos on lymphedema management. Check with your own certified lymphedema therapist first before changing any part of your program, and always talk with your medical provider before starting or changing any new program. While you're doing lymphatic massage, if you feel shortness of breath, chest pain, heart palpitations or fluttering, or something just doesn't quite feel right, stop doing the lymphatic massage and contact your medical provider. The first place that we're going to start is at our abdomen. So we're going to be pressing into our abdomen as we breathe out. If that pressure causes discomfort, then just do the deep breathing. So place your hands on top of your belly button, breathe in through the nose and out through the mouth as you press in. In through the nose, out through the mouth. We're going to do that 3 more times. Breathe in through the nose, out through the mouth, press in. Breathe in through the nose, really fill up that belly. Out through the mouth. And 1 more time, in through the nose and out through the mouth. The next place we're going is up to behind our collarbone. So you're going to place your fingers, the finger pads directly behind the collarbone, and you're going to do 5 to 8 circles just behind the collarbone, stationary circles, and these are going to be slow movements, and we want to do at least 5 to 8 times. After you do those 5 to 8 times directly behind the collarbone, then you're going to take your fingers and you're going to have 2 in front and 2 behind your ears. So from this movement, you're going to bring those fingers in circles, and you're going to do them in stationary circles just like we did behind the collarbone. You're going to do this 5 to 8 times. We're stimulating the lymph nodes that are behind and in front of the ear to help with that drainage. And then after we do the massage at the ears, then we're going to move down to the neck. We have chains of lymph nodes coming down the neck. So I'm just going to show you one at a time, and you're going to take your hand directly below the jaw, and you're going to sweep kind of in a C direction. So you're sweeping down and into the collarbone, down and into the collarbone. So again, we're doing this 5 to 8 times. We want to do nice slow movements, starting to stimulate those lymph nodes along the neck. And then after the 5 to 8 times on the one side, then we're going to move to the other side. And we're going to do those 5 to 8 slow, intentional circles, starting to wake up the lymph nodes on the side of the neck. And make sure you're using all of your fingers, not just the tips of the fingers. And then after the 5 to 8 times along the side of the neck, then we're going to be moving to the lymph nodes in your armpits. So even if you had lymph nodes removed or you had radiation, research shows that lymphatic fluid still can move into those lymph nodes. So you're going to bring one hand overhead or raise it up to what's comfortable. Take your opposite hand, fingers together, and you're going to do slow stationary circles right in the armpit. And we're gonna do that also 5 to 8 times, making sure that you're getting right into that armpit and staying in that stationary circle to help stimulate the lymph nodes. And then after 5 to 8 times on one side, you're going to switch sides, and then you're going to do the other side. So we focus a lot at the neck and at the armpits, because we have a lot of lymph nodes in these areas that fluid is going to be draining to. And then after we do that 5 to 8 times, then we're gonna move back down to the groin. And then you're going to place your flat palm at the hip crease. So it's going to be at the area where that hip starts to bend. You're going to place your hands there and you're going to do circles, those stationary circles, at least 5 to 8 in the groin, and we're stimulating the lymph nodes here down at the groin. These can also be helpful when we start to drain that fluid and get that fluid out of those arms. So I'm gonna start on my left side first. We are going to be doing both sides, so if it's easier for you to do the right side first to mirror me, that's okay since we're doing both sides. So we're going to start by moving that fluid from kind of under the armpit and the shoulder towards the midline of the chest and up in that clavicle or the collarbone. Again, this is where a lot of that fluid dumps to. And so we're going to do a moderate pressure, and we're just gently massaging or pumping, again, from the chest and the shoulder up and over into these areas. We're going to do this 5 to 8 times. And it shouldn't be so light of pressure that you can barely feel it. It should be a moderate pressure. After we do that at least 5 to 8 times, then we're going to move over to the shoulder and we're going to do shoulder circles. So we're going to be going in circles around that whole shoulder as far back as you can reach. If you have a hard time reaching back here, that's okay. Just reach to where you can. And you can also always use a dry brush to help with reaching these harder to reach areas, because some of this is pretty far back. After the 5 to 8 times here at the shoulder, then we're going to start moving at the arm. So when we massage the arm, we massage from the elbow up to the shoulder, the wrist up to the elbow, and then the hand, and then the fingers. So we work our way down first to decongest it and start moving that fluid. If you think about traffic on a highway, the cars down here can't get off until all the cars up here get moved off first. So we're gonna start with your hand either on top of your head, at your shoulder, resting on a table or countertop, or if you're on a couch, on your armrest. And you're going to start by moving the fluid from the elbow and moving it down to the armpit. And you can see with my hand, we're keeping the fingers together, we're keeping them soft, and we want that whole hand making contact with the arm to get as much surface area as we can and help with moving that lymphatic fluid down. Just like with doing the stationary circles and moving the fluid over to the chest, we want to do each of these areas 5 to 8 times. So even though I'm pumping 3 times down the arm, I'm still repeating that 5 to 8 times. The pressure should be a light to moderate pressure, and that's going to help with moving that fluid down into the armpit here. After we do that 5 to 8 times, again, we're working the back of the upper arm. Then you can bring your arm down, and again, you can either rest it on a pillow or your couch, whatever feels comfortable. And then we're going to start to move that fluid up from the elbow and towards the shoulder into the front of the shoulder. So this is getting the front and side of the arm. We're moving that up. And again, we want to do that moderate to light pressure. We're doing this 5 to 8 times as we move that fluid up, and really capturing all parts of the arm, moving with intention. And we don't want to do this too fast. We want to do it slow to help really move that fluid out of the arm. After we work the upper arm 5 to 8 times, we've worked the back, we've worked the front and the sides. Then we're going to work on the elbow. So we have lymph nodes at the elbow, and so we want to stimulate those. So you're going to do circles at the elbow crease. You can do it with your elbow bent. You can do it while you're bending. You're gonna do that 5 to 8 times to stimulate those lymph nodes. And then we're going to start to move that fluid up the forearm. So again, rest it so that you're not using too much energy to hold it up, especially if you do have a really swollen arm. And you're going to now start moving that fluid from the wrist to the elbow, just like we did for the upper arm. So we're doing slow, intentional movements so you can really see how I'm cupping my entire forearm to get as much surface area as I can, and moving that fluid up the arm away from the hand. So the direction here is really important. We never want to move the fluid down because that's just going to be pushing more fluid down into the hand and into the fingers. So always moving it up, away, and into the lymph nodes in the armpit. After you've worked on that forearm at least 5 to 8 times, then we're going to work on the other side of the forearm. And you're going to do the same thing where you're just moving and pumping that fluid from the wrist up the forearm to the elbow. You can see again, you can do 2 to 3 pumps up the forearm, and that's what you're repeating for those 5 to 8 times. Again, it should be a moderate pressure, helping to really move that fluid up into the upper arm and then eventually back into the lymph nodes, getting out of that arm, decongesting, helping you feel better and move better. If you have more swelling here, if you have some fibrosis, make sure that you're working on that fibrosis first. You can give a little bit more pressure into this area to help soften those tissues. After you've done 5 to 8 times at the forearm, so we've worked the front and the back, then we're going to go to the hand. So we're going to massage the hand down, and we're moving it from the fingers to the wrist. So you want to get the full hand. You can also work a little bit into the palm if you are having some swelling into the palm as well, and spending extra time here if you need it, if you have more swelling into the palm. And then making sure that when you massage your fingers, you can do each one individually if you have really swollen fingers. And again, that's gonna be 5 to 8 times at least. And you can work on each one individually. If you do have more swelling in them, it can be a little bit more effective than just doing all of them together. And then you'll do your middle finger, bringing that fluid away from the tip of the finger towards the hand. And then we've got the index finger. And again, you don't need a lot of really deep pressure, but it should be a moderate to firm amount. And you can spend extra time at any of these areas that we just did, and then working down the thumb. Now, if you don't have a lot of swelling into the fingers, you can just do more of a general massage down that includes the front and the back. So you're kind of grasping it like you would a sock puppet, and you're using that hand positioning to work on massaging that fluid out of the fingers. So once we've worked our way all the way down to the fingers, then we're just gonna do 2 to 3 times at each of the areas that we just did. We're just telling that fluid, yep, this is the way that you need to move. We want you out of this arm, back into the system. And then we're working on the inner forearm, moving that fluid up. We've got the elbow. We've got the front and side of the upper arm, moving it to the shoulder. And then we're gonna work on the back side of that upper arm, bringing that towards the armpit. And now, if you have a lot of severe swelling, then besides moving that fluid to the armpit, to the chest and up into the collarbone area, you can also move that fluid down to the groin to help with offloading even more of that fluid. And so if you are moving it down the side of your trunk, you're going to take your hand, fingers closed, and you're bringing it down the side of your trunk to the front of that hip crease to where those lymph nodes are that we moved that fluid. And so again, just like the other areas, you're going to move it 3 to 4 times down the trunk, and that's what you're repeating those 5 to 8 times. You want to make sure that you are actually moving it down the trunk and you're not bringing it into the abdomen, because that's not helping with getting that fluid effectively down into those lymph nodes. If you have a hard time reaching across and moving it down into the lymph nodes, this is a great time to use the dry brush to be able to reach those harder to reach areas. This is also easier to reach if you're sitting or in a recliner versus if you're lying flat down. It can make it a little bit more challenging to reach across the chest and bring that fluid down. So after you've done the side, those 5 to 8 times again, you can do this if you have mild swelling, but definitely if you have more severe swelling in the arm, you can move this fluid down to help with getting that fluid into the lymph nodes in the groin, and then just finish with a couple extra circles here at the lymph nodes at the armpit. All right, so now that we finished the left side, now we're gonna go to the right side. So we're just going to repeat the process that we did for the left, and we're going to mirror it for the right. So we're starting with bringing that fluid up and over into the collarbone and the midline chest area. And we're doing that 5 to 8 times. And you can spend a little extra time here. This is really where all that fluid is getting dumped into. The research shows there's not as much fluid getting moved down into the groin, which is why now with this updated routine, we're spending more time moving that fluid to the lymph nodes in the armpit and into the collarbone area in the midline chest. After 5 to 8 times here at the upper chest, moving that in, then we're gonna go to the shoulder, and you're gonna do those shoulder circles, reaching as far back as you can. And we're going to do that 5 to 8 times. So this is a couple more here, really getting that fluid stimulated, getting it moving. If you have a hard time reaching here, remember you can use the dry brush. And then after we get those 5 to 8 circles here, then we're going to start and move that fluid up into the armpit. So we're sweeping it down with those pumps down into the armpit. So you're pumping, pumping, pumping. So that's 2. So we want to do this at least 5 to 8 times. You can spend extra time if you have more swelling in these areas. Swelling does tend to pocket behind the arm and at the elbows, so that's where you can definitely spend some extra time if you have swelling there. Otherwise, we want that 5 to 8 times, moving it into those lymph nodes in the armpit. And we want that slow, moderate pressure, helping to move that fluid. After you do 5 to 8 times at the back of the upper arm, then we're going to be working on the front and sides of the upper arm, and you're pumping it up the arm to the shoulder. You're pumping, pumping. And you can spend extra time here. As you're doing this lymphatic massage, make sure that if your arm starts to get tired, find some support that can be helpful. So rest it on some stacked pillows. You can rest it on the tabletop or counter, or on your couch armrest, anything to help support your arm, especially if you do have more swelling in that arm that makes it heavier to really hold up well. Just prop it up, and that can be a really great way to save some energy, not make you so fatigued, so you can do this lymphatic massage and do it well. You really want to take your time with this. Once we've got the upper arm worked, then we're going to be doing the elbow. So remember, we've got those lymph nodes in the elbow here, so you can either massage it with your elbow straight, you can do it with your elbow bent, or I like to do it with moving the elbow, just get a little bit more stimulation of those lymphatic nodes in the elbow. And then we're going to move down to the forearm. So you're going to pump from the wrist down to the elbow. And we're doing this that 5 to 8 times. Again, a lot of times there can be some hardened fibrosis. It can feel more firm here. You can give some extra pressure there. Make sure you check out my other video that will be at the end of this one. If you do have fibrosis, that takes you through some techniques and tools that you can use to help break up this fibrosis. And if you do have fibrosis, make sure you're working on that first. Get that tissue softened and then finish with this lymphatic massage to help get any fluid, any inflammation out of that area that you just worked so hard on. After we finish the 5 to 8 times here at the forearm, then we're gonna go to the other side and we're gonna move that fluid down just like we did the other side, moving it from the wrist down to the elbow. And we're doing that 5 to 8 times. As we do the massage, make sure that you continue to do that deep breathing. This should be super relaxing. So breathing in through the nose, out through the mouth. Just nice, easy, rhythmic pressure, rhythmic movements. That is going to be really helpful for your lymphatic system. We do not want to rush through this. We want to make sure that we are taking our time, making those intentional movements to really help get that lymphatic flow going. After we finish the other side of the forearm, then we're gonna go to the hand. So you're going to, and I have my thumb here on my palm, so you can still give some deeper pressure here. And then covering the rest of the hand with my fingers and pumping down, if you have your arm up like this, but you're effectively pumping it up still, but you're moving that fluid from the fingers to the wrist at least 5 to 8 times. If you have a lot of swelling and it's almost like a hump, then moving it a little bit with the heel of your palm first can be helpful. That can help to kind of break up some of that firmness versus just using your fingers. And then you're gonna go to, if you have a lot of swelling in your fingers, massage each one down. And then you still want to do that 5 to 8 times as you do this massage. Nice and slow movement here. And then we want to get to the index finger and really take your time moving that fluid down. If you don't have any swelling in your fingers, then you can do a more generalized massage or even just work on the hand, and that can still be effective. But otherwise you want to work on each finger, or like I said, you can also do more of that general hold. So just like we did for the palm, we're just repeating that for the fingers and massaging those fingers from the tips down to the hand. And then once you've done that, the 5 to 8 times for the thumb, for the fingers, then remember we're going to then do 2 to 3 pumps back up the arm at each of the areas. So we've got 1 and then 2. You can also do a third one here. And then the other side of the forearm, we've got 1, 2. And then we're gonna go to the elbow. We've got those little circles. And then we've got the front and the side of the arm, bringing it to the shoulder. And then we're gonna finish with the back of the upper arm, moving that down to the armpit. And then after we finish that, then again, if you have a lot of swelling in that arm, then you can also move that fluid down to the groin. So you can take your arm up overhead, take the palm of your hand, essentially kind of from the armpit, from the midline, middle of the chest here, and you can then sweep that all the way down to that groin, that hip crease where those lymph nodes are. And again, just like the other side, if you have a hard time reaching this, you can use a dry brush here to help with moving that fluid down. And although we are doing those 3 to 4 pumps all the way down to the groin, we are repeating that the 5 to 8 times. Nice slow pressure, intentional movement. We are not moving it to the abdomen. We are moving it down the trunk and to the groin where those lymph nodes are. So we're gonna do that pumping. Again, this is especially helpful for those of you who have more severe lymphedema. That can help with kind of dispersing a little bit more of that fluid to get it back up into the system. But we know, again, from the research that most of the fluid in the upper quadrant, including the breast, chest, and the arm, it does go to the armpit. So we're gonna finish here. So last place, we're going back up to the armpit, and you're going to do those 5 to 8 circles, really focusing at that armpit. Again, this is where most of that fluid is getting dumped into to get back into the circulatory system. I hope you found this video helpful to start decreasing that swelling in your arms from lymphedema. Please subscribe, hit that like button, and share this video with someone else who needs it. Make sure that you check out my other videos on lymphedema management, including exercises, lymphatic massage, and compression options.